Okay, we're going to look at case number 17 in the microbiology and immunology section. A woman who has recently returned from a city in Southeast Asia presents to a physician with sudden onset fever, severe muscular pain in her back and extremities, and recent joint pain in her knees. Examination reveals an erythematous rash that covers her face and body and generalized lymphadenopathy. What is the most likely diagnosis? This woman is likely experiencing dengue fever, also known as breakbone fever, because of the severe joint and muscle pain associated with it. What is the vector for this condition? The vector is the Aedes aegypti mosquito. These mosquitoes are diurnal, which means they are active during the daytime and live near cities. They are most commonly found in pools and stagnant water. This distinguishes them from malaria-carrying Anopheles mosquitoes, which are nocturnal and are less populous near urban areas. Once a rare disease in the United States, dengue fever began to reappear in the 1970s when bans on pesticides such as DDT allowed these mosquitoes to thrive. The same vector can also carry yellow fever and chikungunya. Which microorganism causes this condition? Dengue fever is a disease caused by a positive single-stranded RNA virus of the Flaviviridae family. This family also includes St. Louis encephalitis virus, Japanese encephalitis virus, hepatitis C virus, and West Nile virus. How does this condition differ from yellow fever? Yellow fever virus is also a member of the Flaviviridae family and has a similar endemic region and transmission as dengue fever virus. However, yellow fever presents with high fever, black vomit, and jaundice, and is not associated with severe joint and muscle pain. After recovering from this condition, will the patient be immune to it in the future? The dengue fever virus has 4 serotypes. The patient will develop lasting immunity to the serotype of the virus with which she was infected, but not to the remaining 3 serotypes. This means that she could contract dengue fever 4 times in all. Infection with a different serotype of this virus poses what potential complications? The most serious complications of dengue fever are dengue hemorrhagic fever, or DHF, and dengue shock syndrome, DSS, both of which can be fatal. These conditions are characterized by bleeding, often from the gastrointestinal tract or from mucosa, petechiae, ecchymoses, or purpura, thrombocytopenia, fluid leakage manifested as pleural effusions, ascites, or hemoconcentration, and shock. Such complications most frequently occur in patients who have already been infected with another serotype of the virus. One theory underlying this phenomenon, termed antibody-dependent enhancement, proposes that antibodies from previous infections actually allow for increased viral replication upon reinfection with a different serotype. This has also hindered the development of a vaccine, since the vaccine must provide adequate protection against all 4 serotypes, or it could put the patient at risk for DHF/DSS.